Hello, my name is Pedro Montelongo, a nursing student at the Tamaulipeca University, Campus Matamoros. Currently, I am in the 84 months of my career, and this time I bring the subject of the Helmich maneuver. Adult, child, baby, and me. Please, join me to learn about this interesting topic and let's learn together.
This is a maneuver to treat acute total choking. That is, when an object enters the airway, it can generate a partial or total occlusion. When it is a partial, that is, leaves part of the permeable pathway, the patient can emit a certain respiratory complaint. Some stridor you can also cough, may cough. On the other hand, in the total, the patient cannot emit any type of sound because there is no communication whatsoever. Then this will be the most serious, which is where the Helmich maneuver is indicated. When we talk about partial occlusion, it is better to stimulate the cough mechanism. If the patient coughs, this is the best way to eliminate objects that are pertly.
Well, here I present the Helmich family, the father Helmich, the kid Helmich, and the baby Helmich. Let's imagine that the three of them having lunch in a restaurant and suddenly all three of them choke at the same time. Then we are going to see the maneuver in Helmich to save his life.
So let's go with Mr. Helmich. The first manifestations that patients make due to choking are: put the hands in neck, angustia, cyanosis on the lips, despair with sideways movements. So what we will do is get behind the patient. We put the right hand in a fist. Put your left hand in front of your fist. We make a stroke movement back and up in the abdomen with the intention of explaining the air. Now we are going to see it from a side view. You put your hand under the ribs and make a strong backward and upward motion to release the object. If the object does not come out after applying several maneuvers, the patient loses consciousness, and when he loses consciousness, what is indicated is the performed CPR. Here we have to start the 30 compressions and then move on the 2 breaths.
Alright, now let's see what happens in the chill. I am going to present you 2 possibilities. The first is a partial occlusion.
If it is partial, part of the air passes. If he grabs is thorax, but if we can hear a certain inspirational exterior. So in such circumstance, we activate the cough mechanisms and it comes out. The foreign body comes out due to the patient's own cough. Now we are going to simulate what will happen if hit were are the total choking. The patient is held by the neck, nothing is heard. We will act with the Helmich maneuver. The only difference with the adult is that we have to raise the child or we get to high height. We do the same maneuver and the foreign body comes out. The only difference will be that putting ourselves in a favorable position for the child's height, so it will look sideways. If the chills do not respond, the Helmich maneuver does not work. Just like the adult, we will have to start the CPR maneuver. Very well. If it were a baby, The first thing we have to do is stimulate their reaction. If the baby does not respond, I can also do it the baby, stimulating the soles of his feet in this way. If this does not work, we have to apply the maneuver. The right hand with a V shape. This is to hold the child's chin very well during the maneuver. We are going to place on our pheromone prone. Here we can see how the baby is with the head lower than the axis of the rest of the body, and we are going to apply 5 blows. If the object does not come out and the conclusion persists, we have the all it be the back of the head. We turn it over, we draw an imaginary line between here two nipples. We perform compressions with both fingers, which will be 5 compressions. Again, taking him from the chin down and another 5 blows. We will repeat this maneuver until 2 things happen. The baby loses consciousness, the object is removed. It is important that when you hit the back, we have the hold it very well on the chin, because if not, you will generate a whiplash effect. If the baby did not respond, the baby lost consciousness. Here it will be indicated the same as in other cases to perform CPR. And finally, it may happen that you are the patient who is choking, in which case you will have to first resort to mechanism of cough. We try to cough several times, and if we notice that it does not work, since it may be a total occlusion, we will perform the Helmich maneuver. We put a fist and hand under the edge, making pressure on it. What will be the problem in this case? Since you are choking, you will not have enough strength to eliminate the object. We must quickly find an object that is hard with a hard edge. This can be a table or a chair. We will drop on that object to exert that force. We repeat the fall several times. If it were a table, we could put over our hand and fist, and so we will eliminate the forehand object.
This will be all. Thank you very much for joining me on this topic.